Might help if I unmuted myself. Let's go ahead and get started. I think we have a good crew here today. I'd like to welcome everyone to Laying the Groundwork, Investing in Infrastructure for Young People in New Hampshire. If we haven't met, my name is Will Stewart, and I'm the Executive Director of Stay, Work, Play New Hampshire, which is a statewide nonprofit whose mission is to attract and retain more young people here in the Granite State. And today we're here to talk about infrastructure, which is defined as, quote, an underlying base or foundation, especially for an organization or system. And typically when we talk about infrastructure, we're talking about things like roads, bridges, water mains, and the like. But today we're going to talk about another kind of infrastructure, which provides an equally important foundation here in New Hampshire. And that's those systems and structures that young people depend upon here in New Hampshire, and without which we risk losing young people to places that do have strong infrastructure for those in the under 40 set. And before I introduce our panelists and we jump into what promises to be a very interesting conversation today, I'd like to encourage anyone who might have a question or comment at any point to share it in the chat so that we might get to as many of the questions and comments as we can and have them addressed by our panelists in our short time together this afternoon. So with that, let's go ahead and get started. And joining us today to talk about the types of infrastructure that are necessary for the attraction and retention of young people here in New Hampshire are Carolyn Isabel, Director, Workforce Development and Planning at Dartmouth Hitchcock Health. We have Amy Brooks, Executive Director of the Early Care and Education Association, and Nick Coates, Town Administrator for the town of Bristol. And now I'll have each of our panelists introduce themselves in a little bit more detail before we get into the conversation proper. Carolyn, why don't you tell us a little bit about yourself and the organization you're here representing today?
Thanks, Will. It's a pleasure to be here with everyone this afternoon. So thank you for giving us this forum and the opportunity just to share, some of our views and how the work that we do impacts all of the people in our state and our communities. Dartmouth Hitchcock Health is New Hampshire's only academic health system and the state's largest employer. Dartmouth Hitchcock Health serves a population of 1.9 million patients in northern New England and with access to about 1,800 providers in every area of medicine. Our flagship hospital is up in Lebanon, New Hampshire, and that's Dartmouth Hitchcock Medical Center. And we're also proud to have Cheshire Medical Center, New London Hospital, Mount Scottney Hospital and Health Center, Alice Peck Day Hospital, and the visiting nurse and hospice of New Hampshire and Vermont as part of our system. I have the privilege to lead our workforce development and planning function for the health system, and I'm coming up on my 10-year anniversary with the organization. Our workforce development efforts over the last few years have really been focused on some key areas. So understanding and planning for our workforce shortage areas, offering skill development opportunities, building awareness of the many roles and educational pathways in healthcare, removing barriers to starting a career in healthcare, and working broadly with our state and regional partners on workforce issues such as housing, transportation, and childcare.
Well, welcome, Carolyn. Thank you for joining us today. Amy Brooks, welcome to you as well. Why don't you let us know a little bit more about who you are and your organization?
Great, thank you. My name is Amy Brooks. I'm the Executive Director of the Early Care and Education Association. The Early Care and Education Association is a fairly new organization. We actually launched in our strategic planning in 2019, and we're pretty well placed in 2020 to take on the challenges that came that March. We represent licensed childcare providers, programs, as well as Head Starts and family, licensed and regulated family childcare in Windsor and Orange County, Vermont, and Grafton and Sullivan counties in New Hampshire. Our three main points of focus when we began in 2019 thinking about resolving the issues in childcare in pre-March 2020, we're advocating for the field, of course, with wages being a highlight, as well as building the workforce and then sustaining our organization. So in March of 2020, we were poised to receive funding and get it directly out to our providers, many of which work in some way with Dartmouth Hitchcock Medical Center. So we were definitely in the essential workforce area. Prior to COVID in 2018, there was a white paper done on the workforce in the Upper Valley, and it revealed that we were 1,500 to 2,000 childcare slots short of meeting the demand. That's 1,500 to 2,000 childcare slots short. And that was pre any of this. We do not know at this time exactly how many slots we are short. We do know that we are operating well below capacity. And that's something that our organization works on every single day. So we have somewhere around 85 providers that engage the ECA in all of our activities. And I am absolutely thrilled to be at this event because we're targeting the age group in which we serve.
Well, thank you, Amy. Yeah, we're definitely looking forward to hearing and understanding a little bit more of this this situation. And yeah, I had not heard that statistic. 1,500 to 2,000 slots under where we need to be pre-pandemic, and just in the Upper Valley, to say nothing of the rest of the state as a whole. So definitely concerning, to say the least. Looking forward to delving a little bit more into the whys and the hows, and ultimately what we can do about this and the other issues we're here to talk about today. Before we get into that conversation, though, Nick Coates, town of Bristol, New Hampshire. Hello, welcome, and tell us a little bit about who you are and what you do.
Great. Well, thanks very much for having me today, and I look forward to hearing what everybody has to say. I'm more so just looking to learn so that we can implement anything that comes out of this in the town of Bristol and the greater region. So I'm the town administrator for the town of Bristol. Been doing that for about 6 years. And a lot of the discussion is coming at a lot of different sweet spots for me. I among other things, I'm also a Campton Select Board member. I'm on the Plan New Hampshire board. I'm on the state's Housing Community Development Board, the Grafton Regional Development Corporation board, and the Mid-State Health Center board. So come at it from a bunch of different angles when we look at this from a housing perspective and economic development perspective, as well as retention of workforce. So I do all the economic development here in the town of Bristol. And that has led me into building a broadband network with our group here in Bristol and the surrounding communities. We're now expanding that to neighboring communities. And in about 2 or 3 weeks, we should hear whether or not we got about a $28 million grant that we applied for to bring high-speed fiber optic broadband to every single town in the county. And then we're looking to replicate that in all of the northern tier counties. So my big focus is really about how do we keep this region vibrant? How do we attract folks? And in Bristol in particular, we focused on infrastructure for 15 years now. We reconstructed our downtown, which then led to a lot of private investment in our downtown and a revitalization of our downtown. And we're looking to continue that with broadband, and we're looking to continue that with other infrastructure as the funding comes available. And I hope we do get into healthcare, into childcare a little bit. It's something that's of great interest to me and a real need here in this area as well. So looking forward to hearing from everybody.
Well, excellent. Welcome again to you, Nick, and to our entire panel. And of course, everybody here joining us today to both learn and hopefully ask your own questions. And again, we invite your comments and your expertise as well. Again, feel free to throw any questions, any comments at any time down in the chat, and we'll get to as many of them as we can toward the end of our conversation this afternoon. So with that, Carolyn, let's start the conversation off with you. You're the resident healthcare expert today, and I think it's safe to say that we're all very much well aware of the challenges facing the healthcare system as a whole these days. What can you tell us a little bit more about these challenges, excuse me, including those related and unrelated to COVID that are impacting the healthcare needs of young people and families in particular? Things like OBGYN services, birthing delivery units at hospitals, pediatric availability, things like that.
Thanks, Will. I'll get myself off mute. So it's no surprise, right? The last 2 years have presented unbelievable challenges to our healthcare workers and systems, both here in New Hampshire and nationwide. As workforce is really my area of expertise, in preparation for today's event, I connected with the clinical leaders in our OBGYN, pediatrics, and population health divisions to get their perspective on the healthcare impacts on young people and families. So I'm going to start with just kind of sharing some of their high-level thoughts on and some of the actions that are being taken to address the concerns. Over the past few years, many birthing units have or are consolidating their services in large part due to cost and also workforce, really trying to make sure that we have the providers we need to care for our moms. But that's also can be really challenging to the local communities. The economic distress that rural families were facing prior to COVID has worsened with the pandemic.
Do you need anything at all, honey? I think I did I not?
Melissa, you're not on mute.
Okay, all good. All good. So as I was saying, the economic distress that rural families were already facing prior to COVID has worsened with the pandemic, and this is impacting the social determinants of health, including things like transportation, food, and housing. Many patients don't have access to basic necessities like a cell phone, which is essential to accessing social services, to schedule a ride for prenatal care or a visit, or to schedule care for their infant. We're also seeing widening maternity care deserts, which is where there's no maternity care available in New Hampshire and central Vermont, which is creating access issues. To help address a few of these challenges, the Children's Hospital at Dartmouth is expanding its telemedicine services and neonatology so that our providers can be more readily available for unexpected or high-risk deliveries. Our teams are also responding through integrated behavioral health services, social determinants of health screening, food supports, and community health workers in the maternity care setting. Unfortunately, if patients are not able to get in to see us for prenatal or postpartum care, we are not able to connect them to some of the resources we do have available. With regard to our pediatric populations, we're seeing more children with mental health support needs, and growing our licensed mental health provider network is a top priority for us. We're working collaboratively with our child psychiatric and social work teams to help address these needs. We're also adding mental health providers directly in clinic with some specialties so that we can provide multidisciplinary care to patients. Initially, during the pandemic, pediatrics saw a dramatic decline in appointments for common medical needs, but over the past 6 months, this has returned to normal levels. Our teams are working hard to try to meet families where they are at and offering both in-person and virtual appointments in order to reduce travel time away from home, work, or school. And I think too, it's just important to note the stress that the pandemic has put on our school systems here, and the support our providers have been, really providing counsel and direction. But our school systems have really been under a tremendous amount of stress too.
Indeed, they have, and I think everything you've mentioned. I mean, very real challenges that I think probably a lot of people on this call today can certainly appreciate and have experienced. And it almost sounds like a chicken or the egg scenario in a lot of cases that young people need these things, maternity wards and pediatrics and all of these things, and might not be inclined to stay in a place that doesn't have them, but at the same time they can't the places that offer these things need the employees and oftentimes young people to fill these slots. So it's certainly challenging. So knowing that, Carolyn, that workforce is your particular area of expertise, and that every night when you turn on the news, we're hearing about these critical staffing shortages. How are hospitals and other care facilities continuing to operate, and what's being done to bolster the healthcare workforce that we all depend upon?
Thanks, Will. It is. I think you turn on the news every night and this is it. It's front and center. But I'll be honest, I don't know if it always feels real. It feels somewhat far away. And healthcare, like many essential services, is one of the societal elements that we depend on, but we rarely think about until the day that we need to receive care. And at the point that we receive care, I think we assume that the doctor's offices, the emergency rooms, hospitals, and home health agencies are going to be there and ready to be able to support. In an ideal world, that's exactly how it would be. And pre-pandemic, we talked about this looming healthcare workforce shortage, but the demands and subsequent exits from this industry have brought that shortage front and center. In August of 2021 alone, a record 4.3 million workers voluntarily quit their jobs in the United States, which is about 2.9% of the US workforce. And in that, there were 534,000 healthcare workers who left their jobs. In the long term, the continued workforce shortage will force changes in care models and increase the utilization of new technologies and robotics. But in the short term, we have to act quickly to encourage and support entry to healthcare careers and the retention and healing of our current caregivers.
Yeah, you're right. We do need to act quickly, and these are sobering statistics in addition to the ones that the one that you mentioned earlier, Amy. So thank you for sharing that, Carolyn, and thank you for all you're doing to help fill these critical slots. And Amy, I know you're very much intertwined with filling workforce positions is the issue of childcare. It's hard to go to work if you don't have somebody to watch your kids while you're doing that. So really curious, Amy, if you can tell us that, I'll step back a second and say that here at Stay Work Play, childcare, given its importance, to young parents and those who employ them, is one of our 5 policy priority areas in our kind of our nonpartisan issues-based advocacy program that we undertake here. Hoping maybe you can tell us a little bit about the current state of the state's childcare system and what groups like yours are doing in response.
Great, thank you. Childcare for many families precedes employment. So essentially, we are the workforce behind the workforce. And unfortunately, what has been going on for the past couple of years has finally highlighted that in a terrible circumstance, but we are finally paying attention as part of economic development, looking at childcare as being as important as healthcare and housing and transportation. Currently, the state of childcare, many New Hampshire childcare programs are still struggling to recover. Though the influx of funding has definitely been the key factor for many providers for not closing. As many as 80% of our programs are still operating at reduced capacity and or reduced hours. So it may not just be that the classrooms are not full, they may be closing early. This, of course, has directly impacted hiring in the state. And not only are working families impacted, but some families are deciding to utilize, the grandmother of the child to stay home and take care of the children. The problem is that takes another usually experienced and more highly trained person out of the workforce to put somebody in the workforce. The key issue with recovery is in the sectors that is similar to Carolyn, is that it requires trained personnel. So you cannot just hire somebody who works in retail into a classroom and expect to open new classrooms. There are minimum qualifications, and this takes time. In New Hampshire, ratios and levels of qualification factor into the level of capacity in a classroom. So we're looking at classrooms, dark classrooms, that unless we were to access our staff that has left and they're already trained, some of those 500,000 that Carolyn was talking about for the healthcare workforce, we are looking at minimal of a year just to get minimum qualifications, get people back into the workforce. Close Closed classrooms, again, can't simply just be reopened if they hire. And so I hear people saying, well, I have somebody great, that would be great, working in a center, but you cannot staff a center with all new staff and expect it to open, because it doesn't work that way. Another major concern is retention of our staff, of our current staff. Burnout is real. Each staff member that leaves a program can mean as many as 12 families that have lost childcare. For each staff member that leaves, it could be as many as 12 families. And on the flip side, if we were able to access some of those staff that have left and maybe working in nanny or private positions, that could open up, two staff could open up as many as 24 slots for families. So, looking at the flip side, if we were to access some of our former personnel that's qualified, or some people who have taken courses in the past and have left the field, if we could get them back, we could recover to a degree while we're waiting to train the new hires. The basic model for childcare is that it heavily relies on parent funds. So though public employment related funding is available for those families that qualify, the market rate that bases that funding, that the funding is based on, is not a market rate for the real cost of childcare. That is the market rate based on the current cost, which is where providers are making a very minimal amount. So it does not reflect the real cost of childcare. So essentially, affordable childcare is subsidized by low wages of the workforce. Let me say that again. Affordable childcare for families in New Hampshire is subsidized by the workforce making very little money. And that's the model we have in New Hampshire. That basically tells the story of, why wages are important to talk about when we're talking about, increasing our workforce and retaining our workforce. Our organization, the ECEA, is tackling several initiatives right now based on workforce retention. Specifically, we have created our first I know of in this area or anywhere in the state. We have a staff committee. We have a committee made up of childcare staff, program staff, non-supervisory, that are informing our work to tell us what types of things retain them, what types of activities keep them excited about their job, how we can support them in avoiding burnout and to take care of themselves. They're also informing some of our recruiting work, because some of those people are working with those new recruits and we need to make sure we're supporting them as they train them. Recruitment efforts, we have tried several ideas since last June, and we've found and learned that in order to recruit today, you need to offer a job very quickly or they tend to go somewhere else. So we are facilitating getting resumes in front of directors as quickly as possible, so those directors can do interviews. Again, if they're not qualified to a minimum level, there's only so much we can do with that want. So right now the ECEA is working on what can we do with this level of interest, though they can't support the workforce directly. What can we do to get them into a program so that within a year they can be used and qualified in a classroom. One other thing I'd like to mention, and Carol and I just came out of a meeting, the work in the Upper Valley that Vital Communities is coordinating. We had a childcare symposium. Obviously in Upper Valley, childcare has been a crisis for a long time, and now it's at its peak. Vitalcommunities.org, they were able to bring together a group of community members to talk about the issues. And we now have 3 sub work groups: an advocacy work group, a facilities and program models work group, which is designed to look at lowering costs within centers, what businesses can do to support that in order to maybe, save up some money so that they can increase wages. And also the work group that I am on, which is the recruitment and retention work group. So that work is very exciting. It is community-based. And there is a cross sector of interest in there. So it's not just providers sitting around a table trying to solve provider issues. It's HR departments, it is parents, families, family supports. We have small business members there. So, and corporate counsel is very much aware of that work and involved in that work, and that makes a huge difference. So yeah, that's just some of what we're doing, and hopefully we will be able to have good news within a year about some of the strides we've made.
Certainly hope so. And, I definitely, it sounds like you're on the right track, I think, certainly with bringing, all of the kind of the affected players together. Because you're right, it's not, childcare is not isolated to a provider. Providers can't be expected to provide all of the solutions because they're only one part of the equation. And I think it's good to get all those perspectives around the table. You're absolutely right. I have some more questions for you, Amy, in a little while that came to me while you were speaking. But before we get to questions, and again, if anyone in the audience has any questions, feel free to throw them in the chat. Any of your experiences you want to share, feel free. Drop them there in the chat. I want to get to those as well. Before we do, though, Nick, want to turn to you. You're kind of the issue of broadband, kind of came to my consciousness in a very real way a couple of years ago. Stay Work Play, we had a what we called our Policy and Pint series, where we went around the state, and this was a couple of years ago, right? Just immediately pre-COVID, different regions of the state, talking to young people about what they like about the region and what might lead them to potentially one day leave. And we're talking a lot about the Upper Valley today. We were in the Upper Valley at an event. We were at Salt Hill Pub in Lebanon, in fact. And this one comment stuck with me from that. Actually, a couple, but this one young person said that he lived a few miles outside of Lebanon, and he said his internet was so poor that he and his girlfriend couldn't stream Netflix. And he said they loved the Upper Valley, had no other real complaints about it, but he said not having reliable internet, for him, and again, this was before COVID and before the work from home era, but he said not having reliable internet was a deal breaker. And I know, Nick, it sounds like at least up till recently, maybe similar issues in the Bristol area as well, that, and correct me if I'm wrong, but unreliable internet, or maybe sometimes no internet for some folks in town. Can you talk a little bit about Bristol's challenges in this regard and the project that you kind of alluded to earlier that helped to bring high-speed internet to Bristol, and like you said, in the future, maybe other undeserved or underserved rural communities there in Grafton County?
Yeah, absolutely. And thank God I don't have to solve the healthcare and childcare solution. That you guys are doing yeoman's work. I really appreciate all the work you're doing. I just get to play with wires and water mains. So, yeah. Well, this is going to sound kind of corny, but my philosophy on life is really comes from Yoda, which is do or do not. There is no try. And so I've always been of the opinion, if you see a problem, you take it head on and you fix it and you figure it out. And you do whatever you have to do to make it happen. So that's exactly what happened here. So Bristol is indicative of many rural communities, really many communities across the state and the country. There's two really underlying issues at play here, and I won't mince words, which is that the cable providers are a monopoly, and their rules have been codified in federal statute to benefit them. And on top of that, providing broadband in rural areas is not profitable, and they are companies that are driven by profit. So those are the things that we came up against when we started to look at how to solve the problem. We talked about bringing broadband in here 6 years ago when I first started, and one of the real challenges that we were trying to solve at the outset was, and again, when I speak of Bristol, I really do speak of the region, the rural region, and really the rural communities of the state, is that we had really almost no cell coverage here in town, and we realized that the only way to get cell coverage was broadband. So we decided to go out and get an appropriation from town meeting and get a grant and get some money and make the problem go away and fix it. And that's exactly what we did. So we went out and built our system over over the last 2.5 years. Again, really kind of came together with a second grant with CARES Act grant that we received from the state. So in total, we built about $2 million worth of network in town. And when we started, along with cell coverage, which is based on broadband, you have to have broadband to be able to have cell coverage. We also recognized the most important piece of what we wanted to do was to connect to Plymouth State University. And the reason why that is that their internet system is connected to MIT, connected to the University of Vermont, University of New Hampshire, and focused on research and development. So what we wanted to do early on, and what we're now implementing, is build direct connections to the university system, to our businesses that are lacking employees, and to our school system, to basically have all three of those connected through an internet system that would allow students and businesses to be able to train remotely. We actually have a program right now where we have a business in town. It's an international firm that is from Germany, and they have an engineer login from Germany, and they train kids in Bristol through that internet connection. And we're looking to implement that at the health center here. We're looking to implement that in some of the trades businesses that we have in town, and that's how we're gonna deal with the problem. We have about 50% of our students who graduate high school don't go off to education in college or community college. And you can look at that as a challenge, or you can look at that as an opportunity. We look at it as an opportunity because that's a couple hundred kids who we could keep locally, provide them good jobs, and provide them training if we get to them early enough. And that's the whole point of our system beyond the cell coverage. The other part of it, of course, is really the quality of life and the healthcare aspects of it, which is what we recognize very early on is that as a rural community, we have a lot of generational poverty, which comes with it drug use and alcohol use and domestic violence, unfortunately. And so we had started having conversations very early on with Mid-State Health Center around how do we provide telehealth to people in the community. And what we learned is that they actually tried to do a telehealth project a couple of years prior, and they weren't able to because the broadband didn't exist. And we're looking at solving problems. How do we solve this problem of generational poverty? How do we get people back on their feet, functioning, and living good, productive lives? And so, again, the broadband system was a big part of that, because now as we deploy this broadband out to our community members, people are going to be able to access it and get that telehealth that they need, and get the remote schooling that they need, and to really function. A couple other things I just want to touch on. And again, what I speak of in Bristol is indicative of other communities that we're working with. Where, as you can imagine, there's a lot of communities who are now calling us, asking us how to do it. And so we're talking to our neighboring communities, and we've got another grant that we're going to be doing to build an additional pieces of network. And then again, obviously to the Grafton County, across the entire county, so that we replicate what we did in Bristol in every single town in Grafton County, and then provide that as a model to Coos County, and to provide that as a model to other counties around the state. I want to just go back a little bit to sort of workforce development and attraction of young people, young families. One of our other major tenets, as we went through this project, is that we wanted to create essentially what we call the I-93 Tech Corridor. We partner with Plymouth State University to do that. So the idea is that every town along the I-93 corridor, basically from north of Concord, would serve as a hub for various different technologies that could be developed. And the backbone of that would be the broadband system. So we said, we'll be the first, and we did. We built it. We are the first. And so now we are now speaking to a couple of different high-tech companies about coming to Bristol for that very reason of trying to bring the jobs here, and to bring young people here, and to make it a place where you can either work at that job and have that high-paying job, or if that job doesn't exist here, that you can work in that job in Boston or Portsmouth or New York or whatever, and you've got the broadband connection to be able to do it. So that's a big part of what we're trying to do is again, trying to create that tech corridor so that people have good, well-paying jobs here and they have training opportunities to do that. We're on the cusp of a couple big things relating to that. And then the other piece I really just wanted to highlight really quickly that we're focused on is, like every community in the state, we have a lack of affordable housing. We did have a 32-unit housing project come to town, which we're very excited about. And we supported that with $500,000 through a grant. And we're looking to do another. And one of the main things that the developers that we're talking to have asked us about is the broadband. They say, where is your broadband system so that we can locate these housing developments so that we can attract people to come live in them. So, it really all goes around, comes around. And, it's a big part of what we're trying to do here as a community. It's been in our DNA for many years to rebuild our infrastructure. And it's just another thing that we've been doing. And we're looking forward to the money that's coming out of Washington to really kind of accelerate some of the projects, not just here in Bristol, but across the county and across the state.
Well, it certainly is. Sounds awesome, Nick. And, thank you for your leadership on this. I know you mentioned that, a lot of the federal money and other, grant sources that have, helped enable this and maybe speed it along, but it wouldn't have happened. That wouldn't have happened, if not for your leadership and the leadership of Bristol as a whole. And, I do think it's a great model, for other communities across the state. And here in New Hampshire, that's, the majority of our communities are, small rural communities that are facing very similar challenges to Bristol. So it's nice to see that there is, kind of light at the end of the tunnel. There is a
I'll take this into the other room.
So thank you very much, for that, and definitely looking forward to seeing that, expanding across not just Grafton County, but hopefully, more across the state, as well. Did want to ask, have a question for both Carolyn and Amy with regard to workforce. And it sounds like, there are, kind of two tracks. There's a short and medium term, challenge and a long-term challenge. The long-term challenge that Amy kind of alluded to is getting people, trained who need these credentials, whether to, lead have their own classroom, or in, Carolyn, to the healthcare fields, all of the credentialed positions, and you have more than that. Certainly at Dartmouth, Hitchcock, and all healthcare facilities have credentialed and non-credentialed employee needs. But, to the extent, those that you need these credentials, certain number of hours and continuing education and so forth. What, if anything, can be done? Amy, you mentioned kind of, we have, this group of people who are no longer in the workforce, or at least in this your workforce, who have these credentials. What, if anything, can be done to, in the short term, at least until you can get new people recruited and trained, to get them, to lure them back, in addition to your, retention efforts that you have ongoing. I'll throw that to both of you. Amy, I don't know if you want to tackle it first from the childcare perspective.
It's a tackle. The cause is the issue that where we're not getting some of our people back. It's a cycle of, they were pulled out during 2020 because we had to reduce our capacity in a classroom. We could have no more than 10 people in a room. So we couldn't take all the kids, so we couldn't take all the families, and so we didn't need the staff. And so the staff started working privately. And because there's no childcare, those people are keeping those at home support systems, and sometimes they're even paid more than what we can pay them. How we get them back, I'm not entirely sure, because in order for those families to go, to give up that in-home person, they need childcare. So I'm not entirely sure how we could solve that problem. I think it's something that the Upper Valley work groups will be looking at for sure, to see if there's some way we can attract those people back. I do think, high school CTE programs would be great if we started going back and looking at high school students. And like Nick said, 50% of their high school graduates are not college bound. If we all had great career technical, programs, that there are lots of jobs out there that are not, immediate college bound. If we could get kids when they're young. So there's one group, and the other group is these, I was listening to Rich Labors, and it was a few months ago, but he did say the 20 to 29-year-olds were the population that was not going back to work right now. I assume that a lot of them are trained in something and they have experience. And why are they not going back to work right now? So there's so many factors that need to be played out. I don't know about Carolyn, but it seems like some of our workforce, especially healthcare workforce, the public inconsistency with the public school issues, going online for 2 weeks, your child's quarantined because they went to a basketball game or a birthday party. Sometimes for families, it's just too much to be taking that time off and having such an inconsistent schedule that it's easier for them to stay home. I have seen that firsthand. I'm not sure if I see Nick kind of saying, yes, I don't know if that's happening to other people. But some of this is just the way the world is right now that's kind of creating these bumps. And I don't know, some creative solutions we could come up with to help keep people at work so that they didn't have to stay home with their quarantine children every other week. Carolyn?
Thanks, Amy. I'm just going to continue on your train of thought. I've got a couple different directions I could go on this one. But when you think about the high school students, I really do think that there's opportunity there. The students that are graduating this year haven't had a normal year of high school since their freshman year. And I think that there's a lot that are questioning whether or not they want to continue into post-secondary and make that decision right out of high school. They've lost some major career exploration time where they have not had the ability to get into different work environments, to test it, to try it, see what they like, what feels good. So I actually think that there's real opportunity there to provide some of these more kind of hands-on, trades-based post high school opportunities, potentially into childcare initially, or into some of our healthcare roles where there is on-the-job training provided. I know at Dartmouth Hitchcock, we have our Workforce Readiness Institute that offers a number of different training programs. So you are able to train and then transition directly to the workforce. And it also leads into a career path in many ways, but it doesn't have to be one direct straight line career path. That, to be completely honest, I would say in both childcare and healthcare, that you could start in one place and very quickly kind of upskill or transition to the next level and really redirect your career as you start to uncover your path and your passions. So I think that we have a tremendous amount of resources here in New Hampshire to help people get started in both kind of the traditional and non-traditional post-secondary paths. So I think one of the biggest things that for me, when I think about how we attract people back to healthcare, is that the message has to change, right? Again, I think about the nightly news, and you turn it on and every night you see exhausted, tired, burnt out, scary environments where people are working and providing care to patients all, in all parts of our country. Who in their right mind is going to say, like, sign me up? That's where I'm heading, especially our young people. But that's exactly what we need. And as we come, and I'm going to say this loosely, as we come hopefully to what is the end of the pandemic, I hope that message can change to one that is filled with more hope and impact and meaning, because the work that is being done by our healthcare providers in our healthcare facilities is difference making, and it's the backbone of our society. And I'll just share a personal example. We just started a new program at our main medical center here a couple weeks ago called the DH Reserves. And it was actually a call out to our administrative leaders to be able to come and help support on some of our front lines, like housekeeping and patient transportation and over in the COVID testing tents. And so I just on Friday night finished my second shift in housekeeping. And I will tell you that it is so engaging to be able to actually contribute in a hands-on way, to see the teams, to do the work. It's physical and it's hard, but it's fine. And you're in the environment. And I will be honest, going home that night, I felt better about my work than what I had done in the last 2 years. And I work hard every day to try to bring people into our facilities. But that is, that hands-on way to contribute is difference making. And I think it's just, we've got to switch the story and find that message of hope and really try to bring people back.
I think hope is something we all need on pretty much every level, and it is, very nice to hear, that that's, having that effect, there at Dartmouth Hitchcock, and wish you success, with that program. I want to ask all of you, as we're coming up on our hour here. I'm really curious, and this is for all of you. I'd love to hear your thoughts on. What based on, we've heard a lot of challenges today, and there are others, and these things are all kind of connected. We've heard that obviously, if you don't have childcare, you can't go to work. If you don't have broadband, it's hard to have telehealth, and connected in a multitude of different ways. So I'd like to wrap up today just by asking each of you what people who are here in the audience, who just by being here are showing they obviously care about these issues, what can we all do to help you in your respective efforts to improve these critical pieces of infrastructure for young people here in New Hampshire? Nick, maybe I can throw it to you. You're never shy.
I got a to-do list, don't worry. I wrote down a couple of different things and you're absolutely right, Willis, they are all connected. So the old saying, show up and speak up, right? I think that was Ray Burton. Show up and talk to your select board at a local level around why broadband is important for your community, and get them to understand what they need to be able to do. And I'd be happy to be a resource for anyone in this on this call or anywhere if they want to learn how to do it in their community. We've kind of created a model that we're happy to do. The next thing I would say is, really, if you're inclined to be a little bit more political, it would be call your state senator. There's $122 million that the state has received for capital projects in the state. And there's very limited use for those dollars. One of them is for broadband. And so that money is going to get pushed out very quickly over the next 6 months to a year. And so that's why it's really important to get your community started. So I just would really emphasize contacting your senator and letting them know that publicly owned, publicly managed broadband systems are in the best interests of your community versus the sort of traditional model of cable companies, which are a monopoly and they're not interested in really serving your community at the fullest extent. And then if you really want to get more involved, and I'm happy to talk with people about this, is to really start a broadband committee, because with all that money that's going to be coming out, you're going to need to have a plan, and be happy to help anyone who wants to get started in that. So that's my little corner of the world in terms of broadband. I could go on and on about other things, but you don't want to hear me do that today.
Well, thank you, Nick. Yeah, and appreciate the offer of assistance. You're probably the state's foremost authority on creating these, so that does mean a lot. Carolyn, Amy, how can folks here on the call and who might be watching this recording after the fact, how can we all help you in your respective efforts, which of course benefit everybody here?
Definitely will. I think making connections when you're out and talking with your networks, if there are people who are looking for ways to get started, promoting the opportunity that does exist within both childcare and healthcare. I think there are training pathways and growth opportunities in both, and both provide a really rich, rewarding, and meaningful career.
Thank you, Carolyn, for having my back on that. Specifically to advocacy around some childcare issues. If you go to New Futures in New Hampshire, they're the advocacy group working on some bills that are actually being discussed right now to support the field. If you're in the Upper Valley, check out the vitalcommunities.org website, or you can contact the ECEA on our website, eceauv.org, and we can certainly help you get involved. Each sector of, or each region in this state has a preschool development grant region, a PDG region. And you can contact me to find out what region you are in, and I can give you the local contact for you. If you want to get more involved in getting childcare stabilized, that would be great.
The workforce behind the workforce, right?
Indeed. I like that phrase. And I will say, speaking of new futures, Stay Work Play, we have partnered with them. We did last month. We'll be doing another training with them coming up on February 17th with regard to advocacy. And they provide a great training program, usually like an hour, that really kind of helps get you more familiar with how to be an advocate, on whether it's childcare, healthcare, broadband, housing, any of these issues that affect, in our case, it's Stay Work Play, the attraction and retention of young people, but really how to be the most effective advocate you can be for your communities, your region, and those issues that you care so much about. So, with that, I would love to thank you all for attending this great conversation here today. Would like to thank Carolyn, Amy, and Nick for sharing of their time and expertise. I'd like to thank you all for attending. Certainly hope it was worth your time this afternoon. And finally, I'd like to thank Dartmouth Hitchcock Health for their sponsorship of this discussion. And without it, today's event simply would not have been possible. So thank you. And as we mentioned earlier, a recording of this discussion was made and will be soon placed on the Stay Work Play YouTube page for anyone who wasn't able to join us today. So we'll be sharing that later on social media and probably via an email as well. So feel free to share it with anyone you think might have an interest. And with that, again, thank you all for joining us today, and have a great afternoon, everyone.
Thank you.